the most critical factor in determining melanoma prognosis is the breast low depth, which is a measure of how thick the melanoma is or how deeply the tumor has penetrated the skin. In general, the thicker the melanoma, the higher the risk of metastases and mortality. Early detection means catching melanoma before it got deeper, before it grew deeper. So now let's come back to our two types of non-melanoma and melanoma skin cancer. In general, non-melanoma skin cancers are common, they're often slow-growing, and they're typically cured with surgical procedures. And I have to say that there is an exception, again, as I quickly alluded to some high-grade squamous cell carcinomas, but in reality, most basal and squamous cell carcinomas do not spread, and they're pretty easy to manage, or relatively easy to manage. Back to melanoma. Melanoma causes the vast majority of skin cancer-related death. In terms of the treatment, melanoma requires wider surgical margins, big scars, and it's deep enough. If it is deep enough, actually, it may require surgical evaluation of lymph nodes in the operating room, and if it spreads to other organs, then additional modalities such as immunotherapy or targeted treatments are used. Yet, I would like to emphasize that caught early, melanoma has a survival rate above 90%. We have many patients with melanoma in our clinic, and once they're done with initial surgery, their lives get back to normal. They come for routine skin checks, and honestly, melanoma is just a history. It's their history, and they're enjoying their lives. And that can only happen if melanoma is caught early before it gets deeper or spreads to other organs. In summary, so here's what I hope that you take away from this. If you've been told you have skin cancer, don't panic. But don't assume that it's all the same. Some skin cancers are slow and local. Others, like melanoma, can be fast and fatal. And the only way to know the difference is to have it properly evaluated. And if you have noticed a mole changing or a new spot or something that just doesn't look right, just get it checked. Your skin is actually the only organ that you can examine with your eyes. So let's use that to our advantage.